thought to yourself, I'm a doctor, I'm a pharmacist, I'm a nurse, or a public health expert, and healthcare is not for me? Well, that's what I thought. I am a pharmacist by training with a master's in public health and an MBA, and today I work in big tech, helping large healthcare organizations to solve real life problems using cloud, AI, and data. So, in this video, I'll be breaking down 5 healthcare roles in tech that you can position yourself for, especially if you live in the US or North America and even globally. We'll talk about actual salaries, the qualifications required, as well as the key responsibilities. And I'll be using job postings from Google, AWS, Amazon, Microsoft, and Databricks. For the purpose of this video, I'm going to focus on 5 main roles. One is the healthcare life sciences account executive or the global account manager. 2 is a clinical specialist. 3, principal clinical technologist. 4 is the clinical experience manager, which is a role that is more role specific, usually tailored to nurses, radiologists, pharmacists. And 5 will focus on research engineers. Now let's get started. So, the first one is the healthcare account executive. This role is for people with relationship skills and the knowledge domain. If you've ever worked with business executives, department heads, as well as pharma leaders, and you love being the bridge between clinical teams and solutions, then this role is definitely for you. So what do? They're in charge of huge healthcare accounts, usually large pharma companies or healthcare systems, and you're meeting with CIOs, CTOs, and business leaders on a day-to-day basis. What you do is to position cloud, AI, and some software solutions to healthcare leaders, usually to help improve patient outcomes, for automation analytics, as well as improve clinical research. Another key responsibility that they have is they drive end-to-end deals, which includes identifying opportunities, crafting solutions, as well as closing multi-million-dollar contracts. So, what do they earn? According to a job posting by Databricks, for healthcare or life sciences account executive, the salary range is between $250,000 to $350,000, and that's total compensation. While a similar role called the global account manager, health and life sciences at AWS has a compensation of $150,000 to $250,000 plus equity, bonus, and benefits. So total compensation could be really, really high. For this role, I want you to know that these are senior level roles and senior level compensations. It doesn't mean that you cannot earn in the early hundreds, especially if you have an advanced degree and if you have some sales experience. You are definitely a good fit for this role. Now, minimum qualifications for the healthcare account executive includes 7 to 10 years of experience engaging with senior leaders, IT leaders, as well as clinical leaders. You are also at an advantage if you have experience selling SaaS solutions and you have done a lot of business to business sales. Usually, the educational requirement is a bachelor's degree. An MBA or a master's is a plus. And with those, you might then be considered with fewer years of experience. So why does this role work for you? It works for you because you are not just the typical salesperson. You come in with 2 caps. You have the healthcare knowledge and you have the tech knowledge. So if you have been considering a bridge between healthcare and technology, and you also have relationship skills, then this role is for you. Number 2, clinical specialist. This is an example of a role of a physician that is working in tech, not actively seeing patients, but helping to shape health programs that can benefit the population. So in this role, you are using your clinical experience to help guide healthcare programs that impact the lives of patients or even members of staff of the company. Now, the salary range for this role is $120,000 to $170,000 plus equity, bonus, and benefits. So before you think that that is low, consider the total package. In addition, the minimum qualification is you need to have an MD or its equivalent, so you should be a physician. Also, you must have completed residency in internal medicine. If you're a doctor and you're thinking, I do not want to do traditional clinical work, this role is for you because it still has clinical knowledge or clinical expertise at its core, but your impact is at a larger scale because of technology, policy, and regulations. Third is the clinical principal technologist. So see this role as a clinician that is also a technologist that sits between AI teams and the real world. They usually work with AI scientists, product managers, engineers to develop AI-driven healthcare experiences. According to a posting by Amazon, this role has a pay range of $170,000 to $294,000 plus benefits, sign-on, and equity. So this is a senior level or principal level role. The minimum qualification is MD or PhD with hands-on clinical or research experience. They also want you to be familiar with AI and machine learning. So you have to take note of that as you're going into this application. This role is a poster child for I know medicine and I want to help shape how AI is used in healthcare. So if you love clinical research, patient safety, and regulations, then this role is for you. The fourth role is the clinical experience manager. So for this role, I'll be comparing two postings, one from Microsoft, so it says clinical research manager for radiologists, and then the chief pharmacy advisor, which is a role posted by Amazon Pharmacy. Now, in the clinical experience role for the radiologist, your main focus is really to help shape and improve outcomes for radiologists. You are looking at radiologist workflow as well as quality assurance. For the pharmacy role, as the chief pharmacy advisor, you would lead pharmacy practice there, and they expect you to be very conversant with both the state and federal regulations as it pertains to pharmacy practice. The minimum qualifications definitely include being licensed as a pharmacist, and you must have an active license that can be easily transferred to different states across the US. Being a radiologist is a plus, but actually you can come in with a computer science or an engineering degree, provided you have experience in radiology or you have worked in radiology technology before. The pay range for both roles differs considerably from each other. While on the radiologist side, the range that Microsoft posted was between $119,000 to about $230,000, while for the Amazon role, the range was between $150,000 to about $250,000 plus potential benefits, sign-on, and equity. These roles tell clinicians you don't have to leave your professional identity for tech. You can still be a pharmacist or a radiologist and work in tech. Your impact is just on a larger scale right here. The last but not the least is the research engineer role. So let's flip it to the technical side. This role is perfect for people that love coding, AI, machine learning. So you're really at the heart of writing codes that help develop products for health and well-being. Your mastery of artificial intelligence as well as machine learning is very critical for this role. You would help deploy Gen AI LLMs in whatever organization that you're working in. You need to be a master in that space. The salary range as posted by Google is between $140,000 to $200,000 yearly, plus equity, benefits, and potential sign-on bonus. The minimum qualification is a bachelor's degree in computer science or engineering, 2 to 3 years experience working in software development, and preferred qualifications include a PhD or a master's degree in this required field. If you are somebody that loves biostats, Python, and R, come closer, this is your role. This is a good way to get into tech by pivoting into data science and engineering and still being close to healthcare. So if you are somebody with a healthcare background, these are the top 3 things I want you to take away from this video. Number 1, tech is not for other people. These roles require people that understand patient safety, technology, as well as workflows. Number 2, there are multiple paths for you. You just need to be open-minded and be ready to explore. We covered only 5 roles in this video, but trust me, there are a lot more that would be suitable for your specific skill set. And lastly, your skill set, your experience, and your degrees are an asset. Do not hide them. And I think in another video, I will talk about my own journey and how I almost thought that nobody would consider me in tech. Finally, if this video opened your mind to what is possible, let me know in the comment section. What is your background? Which of these roles would you be considering and why? I am also planning to do a follow follow-up video that will talk about how to pivot into these roles, especially as someone without a tech background or someone who is just coming out of college. And I intend to lay it out step by step. So we'll look at what your resume should look like, what lingua you should be using in your resume, and how to actually apply for these roles. Remember, just because you started your career working in a clinic, pharmacy, or hospital, that is not the end of your story. Tech needs you, and we will definitely need to build this AI safe world together. Take care and see you in the next one. Bye.
The Lord bless you and keep you. The Lord make his face shine on you and be gracious to you. The Lord turn his face toward you and give you peace. Numbers 6:24-26.